We eat food for energy. Whether you're living in New York or Tokyo, carbohydrate forms a major part of our diet. When we consume carbs, our body cannot absorb them in the form they are ingested. Instead, carbs have to be broken down into simpler forms called glucose, which is then taken up by the cells. The hormone insulin is responsible for converting glucose into glycogen, which can be stored in cells for later use and energy production. The problem arises when the pancreas fails to produce enough insulin, or the body cannot utilize insulin due to the resistance, which causes glucose levels to go haywire and ultimately giving rise to a condition known as diabetes. There are several ways to combat this. Firstly, diet and lifestyle changes are the most important, and if that fails, you might need to go on medication such as metformin. For anyone who has taken metformin or other diabetic medications, you will know that there are some nasty side effects that come with this. That is why natural supplements to help lower blood sugar are gaining so much popularity. Diabetes is not just a mere imbalance of vitals. Being a chronic condition, it affects other organs, especially the eye, heart, kidneys, blood vessels, and the feet. In today's video, I have combined scientifically proven supplements to lower your blood sugar levels naturally. So stay tuned till the very end and let's get started. The first supplement on our list today is berberine. Berberine is a natural compound found in many plants including golden seal and barberry. The hypoglycemic effect of berberine was reported in 1988 when it was used to treat diarrhea in diabetic patients in China. Since then, berberine has often been used to lower blood sugar levels by many doctors. How does it work? One of the main actions of berberine is to activate an enzyme in your cells called AMPK. AMPK is like a master switch in your body cell and acts like a sensor that detects the energy levels within your cells. When your cells need more energy, like during exercise or when blood sugar is high, AMPK gets activated and helps improve how your body uses glucose and regulates energy. In simpler terms, AMPK is like a cellular energy manager, and berberine is like a tool that helps AMPK work better to keep your body's energy and blood sugar in balance. This is supported by many studies which have shown that berberine can significantly lower blood sugar levels in people with type 2 diabetes. It is proposed to work via multiple mechanisms. It can decrease insulin resistance, making the blood sugar lowering hormone insulin more effective. It can also increase glycolysis, which helps your body break down sugars inside cells. It can also decrease sugar production in your liver, slow the breakdown of carbohydrates in your gut, and also increase the number of beneficial bacteria in your gut. One study in 2008 followed up with 116 people with diabetes taking 1 gram of berberine per day. The result was a 20% reduction in fasting blood glucose level, and it also lowered HbA1c levels, which is a marker of long-term blood sugar regulation, by 12%, and even improved levels of blood lipids such as cholesterol and triglycerides. As a further benefit, berberine may also help you lose weight. Berberine's effect on insulin and gut microbiota may be partially responsible for potential weight loss. Also, better sugar regulation may mean a more regulated appetite and reduced cravings. Taking 1.5 grams of berberine per day split into multiple doses before meals is a common dose to lower blood sugar levels. Berberine can interact with certain medications such as cyclosporine, so it is best to talk to your healthcare provider before starting the supplement. It also has an outstanding safety profile, but there are some reports of diarrhea, constipation, and bloating as side effects. The second supplement is chromium, which is a mineral that appears to have a beneficial role in lowering blood sugar by enhancing the action of insulin. As previously mentioned, insulin is a hormone that helps regulate blood sugar. Many people are low in chromium, but it is rare to be truly deficient in chromium. People that are most likely to be deficient in chromium involve the elderly, people who eat a lot of sugary food, those that do a lot of strenuous exercise, and pregnant women. Several studies have shown that there is a strong association between chromium deficiency and increased blood sugar, triglycerides, and cholesterol, increasing the likelihood of developing diabetes and other metabolic disorders. Although data is a bit conflicting, several studies have shown the benefits of chromium lowering blood sugar. In a randomized controlled trial, 50 patients with type 2 diabetes were administered either with 400 micrograms of chromium percolonate or placebo for 12 weeks. Those who took chromium showed a significant reduction in both fasting and postprandial after-meal blood glucose. In comparison, the placebo group experienced a worsening of these parameters. Additionally, in a larger study of over 62,000 adults, the likelihood of having diabetes was 27% lower in those who took chromium supplements. Since chromium is not absorbed very well into the body, it's important to factor in the type of chromium you take. Out of the different forms, chromium perchlorate has been shown to have superior absorption compared to the other types of chromium. The maximum safe level of chromium intake is not known, but several studies have shown that daily doses up to 1000 microgram of chromium are safe. And one thing to note is that chromium supplements should not be used for people with kidney or liver disorders, and also those that are taking iron supplements, as it can interfere with the absorption of iron. The last supplement on our list today is cinnamon. Cinnamon is an aromatic spice that most people will have in their pantry. You may associate cinnamon with cinnamon rolls or with your breakfast cereal, but it actually has been around for thousands of years in traditional medicine and food preservation. Several different varieties of cinnamon are sold, and they are typically categorized into two different forms. Ceylon, which is also called true cinnamon and thus is the most expensive form, and cassia, which is the less expensive form of cinnamon and found in most food products. While both are sold as cinnamon, studies have shown that Ceylon contains more antioxidants and therefore may offer more health benefits. Also, cassia contains a harmful substance called coumarin, which may be toxic to the body, especially the liver. Therefore, naturally, Ceylon may be a better option for you. The way cinnamon works to lower blood sugar levels is by imitating the effect of insulin and increasing the movement of sugar from the bloodstream into cells. It also increases the sensitivity of muscle tissues and fat to insulin, so its uptake is increased. Furthermore, it can improve glycogen synthesis by the liver and slows gastric emptying to prevent a spike in blood sugar after eating. Cinnamon's benefits for lowering blood sugar have been well studied. However, no consensus has been reached regarding how much you should take to reap the benefits. Most studies have used between 1 to 6 grams either as a supplement or powder added to food. However, keep in mind that cassia cinnamon contains coumarin, so it is best to stick to lower doses of around 0.5 to 1 gram per day to avoid surpassing the tolerable daily intake of coumarin. On the other hand, Ceylon cinnamon contains significantly less amounts of coumarin and can be consumed safely in doses of up to 6 grams per day. So that wraps up our list of the top 3 supplements to naturally lower blood sugar levels. Remember, supplements should complement a healthy diet and lifestyle, not replace them. Consult with a healthcare professional before starting any new supplement regimen. If you found this video helpful, give it a thumbs up and don't forget to share it with someone who might benefit from this information. We'll see you in the next video. Stay healthy and stay amazing.